In Chapter 10, we're going to talk about diseases that are caused by fungi or funguses. Okay, to start with, we're going to start with histoplasmosis. And these are just some more things to get you thinking about the different bacteria, fungi, protozoids that are all around us. Histoplasmosis is found in the feces of bats and birds. It grows in the soil with a high nitrogen content and has been an endemic in the Midwest for many years, but now is spreading to other parts of the country. An estimated 500,000 cases occur in the United States every year. That's a lot of cases, and you probably never even heard of histoplasmosis. When the soil of chicken houses or bat caves is stirred up by raking, windy conditions, or by some other means, the spores will rise into the air and then they're inhaled. Incubation period is 5 to 18 days. And I know this sounds kind of a little neurotic, like I probably am, but I love birds. I love listening to birds outside, but I will not feed birds because I do not want any of their feces anywhere near my house because I'm afraid of this histoplasmosis, because I actually had a neighbor that got this, and this was a while ago before they had really isolated what it is, and he painted bridges for a living. And you know how birds build their nests in, the pigeons and so on will build their nests in bridges. Well, he would knock these nests down, and here he inhaled the spores and he got it very, very, very sick. It's very hard to treat anything in the lungs, obviously, because of the location of how deep the lungs are, but he was a very, very sick man. So histoplasmosis is pretty nasty. There is no person-to-person transmission, so one family member is not going to spread it to the next. The inhalation of the spores from the soil that have become airborne is the main means of transmission. Also, spores into an open sore. It's very rare, but you can also transmit it that way. The primary lesion is in the lungs. So that's all from breathing it in. Primary, acute, the symptoms are flu-like. The individual just doesn't feel good, and actually what ends up happening is these spores multiply in the nodules of the lungs, in the lymph nodes, and in the spleen. Acute disseminated histoplasmosis, the liver becomes enlarged. Spleen, once again, think about why your liver and your spleen would become enlarged. It has all to do with our immune system and our B cells, T cells, and our spleen and liver working overtime, basically, to try and prevent this pathogen antigen from entering the body. Chronic disseminated histoplasmosis, the individual gets a fever, becomes anemic, hepatitis. They can get endocarditis, meningitis, ulcers of the mouth, larynx, stomach, and an infection in the adrenal glands. Chronic pulmonary histoplasmosis. It mimics tuberculosis and causes a productive cough, not a dry cough, but a productive cough, difficulty breathing, and bloody sputum. Eventually, the victim starts suffering weight loss, weakness, breathlessness, and cyanosis. The individual may have periods of remission where it seems to kind of go away and then it comes back. Treatment for primary acute histoplasmosis, there requires no treatment. The other two kinds, usually long-term antifungal medication for about 10 weeks, and prevention. Any individuals that are cleaning chicken coops, starling nests, bat caves, in my friend's case, painting the bridge. Any situation where you're going to be stirring up any sort of dust from birds or bats, you should be wearing a mask. The next virus that we're going to talk about is, I'm sorry, not virus, fungus that we're going to talk about is candidiasis, also known as thrush and moniliasis. Candidiasis is an opportunistic yeast-like viral infection of the skin or the mucous membranes. Opportunistic, remember, that means that it takes advantage of a situation when the body is weaker. It often occurs in babies through diaper rash in the mouth is called thrush, or in the vaginal area is the moniliasis. It's a fungus that's a natural inhabitant of the human body, and incubation for thrush is 2 to 5 days, and it is communicable as long as lesions are present. Candidiasis, a lot of times we would see individuals that wear dentures. Okay, so if we go back and we think what does a fungus like to live in, and it likes like warm, dark, moist areas. Okay, so the mouth would be a perfect spot for thrush or for candidiasis because it's warm, dark, and moist. And if somebody wears a denture, which we don't see a whole lot of patients wearing dentures anymore, there are some, but they put that denture in, warm, dark, moist, no air gets to it. A lot of patients would want to sleep with their denture, and they would come in, they would have thrush, and it's a very painful disease or organism to have in your mouth. Individuals on chemotherapy, when their resistance is super low, will get thrush, very painful. When an individual is on antibiotics, you will see the patient will have a higher risk of getting thrush or the moniliasis, vaginal yeast infection. The antibiotic is killing all the bacteria in the body, leaving, it's obviously not going to touch the fungus, and it's leaving the fungus there, and the fungus, being opportunistic, is just going to take over then. The transmission is by secretions or excretions of infected individuals or carriers. Males can carry it and pass it to females. Males are not going to have as many signs and symptoms of having genital yeast infection as females do. So the male can be carrying it and then spread it to the female, and that can go back and forth for until they actually get that, get it figured out and get it treated. A baby can get it coming through the birth canal of the mother if she has candidiasis infection while delivery. You can get it, obviously, sexual intercourse, passing it back and forth. And individuals, like I had said in the last chapter, HIV patients or AIDS patients you will see have thrush as well because of weakened immune systems. And that goes along with the cancer patients or patients that are under some sort of uh, treatment, such as stem cell treatment, chemotherapy, radiation therapy of the head and neck. You'll see the individual have thrush. Moms can pass. No, let me go back on that. If babies get thrush and they're nursing, mom will get the candidiasis on her nipple, and of course that's very painful for the mother, but the mom, if she doesn't get rid of it completely, passes it back and forth to the baby and the baby to the mom. So it's not difficult to get rid of once they isolate it and know exactly what you have. The symptoms depend on the site. On the skin, it can be scaly, red, papular rash, often appearing in creases of the skin, such as under the breast or in the vaginal area. Infants with diaper rash develop little papules at the edge of the rash. They used to think that diaper rash was caused by, letting a baby sit in a dirty diaper. That's not the case. Think about what the environment is for a diaper. Warm, dark, moist. That's where the fungal infection will take over. In the mouth, it's patches on the tongue, in the mouth, or in the pharynx, burning in, this is in mouth, that would be in the mouth and throat. Vaginal is white or yellow discharge, extremely itchy, painful intercourse. And the treatment is pretty simple. Like I said, it's antifungal medications. Okay, and here's a baby with diaper rash. You can kind of see the little papules all along the outside. This is a pretty extreme case of diaper rash, and you can just imagine how painful every time the baby urinates or has a bowel movement and that hits that, basically open sore, how painful for the baby. Okay, this is thrush. This would be the patches you can see up along the buccal mucosa. If you look at the roof of the patient's mouth, you can see the patches along the hard palate and all along on the tongue. Imagine how painful this would be. This is also this. If you've ever, the commissures, which are the the sides of your mouth, you can see the cracks that he has. This is called angular chyloses, and this is actually a fungal infection as well. Um, if you have thrush, a lot of times it comes outside the mouth, and if you have any little cracks on your lips or the sides of your mouth, that fungus gets in there, and the tissue tries to heal over, and it holds that fungus in there, and it just continually gets worse. So, and the patient tends to, you know, constantly rub their tongue on that area, which, you're continually spreading that fungus from your mouth to the commissure of your lips. And the fact that, once again, that's going to be a warm, dark place, once it tries to close over, it's going to be difficult to cure. This is candidiasis. You can see the folds of the skin. It's under the patient's breast, and obviously the breast would come down over, and there would be, you know, warm, dark, moist again, and it just goes a little bit, kind of crazy, kind of takes over, and once again, extremely painful. Dermatophytoses, tinea, derma meaning skin. This is a fungal infection that it affects skin, head, nails, beard, anywhere on your body, foot, hands. You can read through these yourself. The tinea barbae is the beard, the tinea capitis is the head, and tinea cruis is the skin in the pubic area of men, which is, called, referred to usually as jock itch. Tinea pedis is athlete's foot, and tinea menugum is of the nails, fungal infection of the nails. And this is a picture of athlete's foot. And you can see usually it gets in between the toes. If you have athlete's foot, you can almost guarantee you're going to get toenail fungus. Athlete's foot is something that it's difficult, once again, to get rid of the whole warm, dark, moist area, and it kind of goes away with treatment, and then it'll come back. And this is caused specifically by walking in the shower, going in public places with bare feet, and if you get it and you shower in your shower and your spouse showers after you, she's probably going to get athlete's foot also. A lot of medications out on the market for athlete's foot, for jock itch, for the angular chelosis that I showed you a couple slides ago. That usually we recommend something that you use for athlete's foot that's in a cream form for that. There's a ton out on the market for it. And this is just a picture of toenail fungus, because you'll see this a lot in, I hate to say older men, but yeah, older men that really don't, care that much about what their feet look like. This particular person, a lot of times what they'll end up doing is just removing the toenails altogether. There is a new medication that's been out for a couple years that is you can take orally for nail fungus, and it's very hard. The liver is where it's broken down and metabolized, and it's very hard on the liver. And it will kill the bacteria, the fungus, but you will not, all this that's dead, you'll start new growth from the bottom. So it takes about, however long it takes to grow a new toenail or fingernail is how long it takes to have a normal nail again. So, it could be up to like 9 months actually. And the the other ones that we kind of talked about a little bit, I'm not going to go into huge depth on them. You can read up on them a little bit, but talking about the fungus of the beard, it usually comes from like a hair follicle that gets infected, and the scalp. People a lot of times think that's like a ringworm. It is a fungus. It is a fungus. Ringworm is a fungus too, but it's a different fungus.